2, 1, 0.
Real people, real issues, real life. Talk Recovery Radio. Live from the heart of the downtown east side, it's Talk Recovery Radio with Giuseppe Ganci and Darren Gaylor on Vancouver's Co-op Radio, CFRO 100.5 FM. From the streets to the studio, bringing you addiction recovery stories from real people with lived experience and real experts on today's issues. Tune in live every Thursday, noon to 1. Powered by New West Recovery. Real people, real issues, real life. Talk Recovery Radio.
Good afternoon, Vancouver. Hello, hello. You're listening to Talk Recovery Radio. I'm here with my co-host, Mr. Darren Gaylor. Hey, Darren.
Hey, Giuseppe. Welcome to Talk Recovery,
everybody.
everybody.
Yeah, 8 years of shows, hundreds of listeners. No, thousands of listeners, hundreds of guests. That's how it goes. So today we're going to have a great show. We're getting into the holiday spirits. We're going to talk about some holiday tips for you coming up. But we like to start the show off with some, what's going on in the news and our new premier here in British Columbia anyway. David Eby has come up with a safety plan, a promise of making the streets of Vancouver safer, Darren, for you and your family and your friends and your mom and everybody else. Lots of criticism on that safety plan coming out of the downtown east side, saying, hey, that's interesting. You got a safety plan about us. So like we're not involved in any of the planning. I don't know. It's just interesting. It's like recovery community is not part of the planning, and who should be part of the planning, Darren?
I mean, yeah, in a politically correct society, everyone, right? We all sit around a table, and I'm all for anything at this point. Somebody wants to come in and just make a bunch of decisions all on his own that's different from what's been going on. Sure, let's try it.
Well, we've tried the plans with everybody's input, and look where we're at. We got lots of interesting things happening, like the overdose crisis. Sadly, thousands are still dying and so forth. Yeah, I'm just Googling it all right now, looking, and I mean, it's violent offenders, repeat violent offenders. He's going to try to tackle that.
I wish I read a really good article. I can't. Maybe I'll take a second. We can post it later. But the journalist he'd covered the downtown east side for many years, and the title was something about how compassion is killing that area, right? Like it's like an insane level of compassion where it's sort of gotten into complacency, like where society drives. We just drive right by it, thinking like, oh, all the resources are there, everybody's taking care of it. Meanwhile, I mean, it's like my own kid, right? Like, am I just going to be like, he's his own person, making his own decisions? No, he's under the influence. He's out of his mind. Mm-hmm. Like, these are people that aren't going to make clear and wise decisions for themselves. And yeah, maybe a little consequence or a little force,
Everybody I know that's gotten well, kind of had some consequences to make their behaviors change. It's an interest, meet them where they're at and wait until they're ready. Well, no one's really ready with a pocket full of cash and a pocket full of dope. I ended up in rehab because I ran out of money and I ran out of dope, and I don't know where I'd be if I had a pocket full of dope free provided by the government. So this brings the I'm not one to criticize, so it just I'm reading the sound bites and everything. I've never met David Eby, and I met our Minister of Mental Health and Addiction, Sheila Malcolmson, talk about things. But so, like, for one thing, they're going to try to make St. Paul's Hospital more available to provide treatment, and it's kind of like, well, wait a minute, they already do that. rapid access to medications and stuff. So what does that even mean when you say that's going to happen, and who's involved in that? And what's the like if you look at the Alberta model, like they have a recovery oriented response, and they have like what does this mean, and these are the categories. So is St. Paul's Hospital just going to give more medications out? Like what's the other services for people? Because it's not easy to get a residential bed-based service here in BC. There's still wait lists and all that. So it's kind of confusing as to what actually this plan is, and it should be confusing because he's the new premier. So I don't think he's actually got a plan where it's going to get executed tomorrow. So let's give him the credit to the benefit of the doubt, I guess is the other word I want to say, to help create this plan. And the only request I kind of have from our little humble show, and from the humble stage here behind us of Recovery Day, just include people, and not just the people with the loudest voices. Include the people with the anonymous voices, include the recovery community, and how did they recover, and listen to our stories. Like a lot of us are saying, like we wouldn't be clean today or sober if we had an endless amount of free drugs, and there's value in that, but it's not being valued, and it's a legitimate fear. And I just hope somebody's listening that knows Sheila Malcolmson or knows David Eby, and like that needs to be put onto the drawing table. And the whole idea, like dead addicts can't recover, and like what does that mean? Like and so what should we do? You know what I mean? Like what should we do? And yeah, safe supply is part of that, but it can't be where all the energy is put and kind of just left in an SRO for the rest of their life, until they're ready. Well, but if they're never ready, is that the life? So I know I say it, I've said it on the show, the worst time of my life was when I had an apartment with drugs and a door that locked. Worst time of my life. So that's not the solution for lots of us. Might be for some, but not lots of us. So you're listening to Talk Recovery Radio. We'll keep on top of what's going on in Alberta, what's going on in BC. That's our kind of neck of the woods. What's that? You found the article?
This is the article out of the province, Douglas Todd, Why Compassion is Failing Vancouver's Most Distressed Neighborhood. Just give it a read. It's an interesting perspective. I mean, like I said, I'm all for change. Drastic change.
I'm going to say something that might offend some people. I've learned that there's this weird sense of self-centered compassion that happens in British Columbia that I've never really seen anywhere else. I've been to other provinces, I've been to other places. I'm not a traveled world person, but I've been to Portugal, and it's like, is it compassion, or is I feel good being a frontline worker with my naloxone kit and my army boots, like I'm a soldier, that I've done something for you, but that person is completely destroyed and needs a 911 call right now. But you know what? I gave them a needle. I gave them a naloxone kit. I feel pretty good about it. So is it compassion with a little bit of self-centeredness and making sure they feel good doing what they're doing? And meanwhile, like the person they're helping is just absolutely destroyed. I hope somebody that's a lot smarter than me takes a look at that, and kind of like, I think that's one of our crises that we have right now, where it's like, who actually feels good? The person doing the service, or the person that's actually receiving the service?
Yeah. Like we've said it before. I mean, you have to save a life, right? Like there has to be breath in order to provide hope. But it's just like that whole area just focuses on the breath, and that's it.
Nope.
That's it. Now head on down to get your free meal and your safe supply, and that's it. And maybe we can talk more about it in this show.
It's racism, it's discrimination, it's that's all you are, that's all you're good for. And let's put a little disclaimer here. If you're a pilot, a nurse, a doctor, somebody with money, you're going to a beautiful abstinence supported treatment environment to get well. If you're poor, you're First Nations, you ain't got the money, you don't have the recovery capital, you're getting in line and you're getting some kind of service that wouldn't be available because it wouldn't be okay to give to somebody that's above the poverty line. So that's what this is all about, everybody. This isn't against anything. This is the fact that there's like discrimination in healthcare in Canada, depending on your value that society thinks you're valued at. So yeah, anyway, so that's what we're fighting for every time we do this show. Talk Recovery Radio, powered by New West Recovery, Canada's recovery community. You know what we didn't talk about, which I wanted to, but we're running out of time, was Recovery Month Canada. We had our committee meeting, a first one last week. We'll try to talk about that later on, but just follow our Facebook. Go to recoverymonthcanada.ca if you're like wondering what that is. And we're trying to inspire local grassroots recovery day movements across Canada. I don't want to organize them. I want people to, let's get out there and one day, hopefully, events like the one you see behind me in my screenshot are happening across Canada. The more we talk about recovery, the better it is. Plain and simple, period, full stop. The more we talk about recovery, the better it is, because people honestly don't know what it is. And what is it? It's that. It's life. It's breathing. It's happy. It's everything. So Darren, I'm going to get our guest on the show. Shout out to Vancouver Co-op Radio while we do that. Thanks for giving us an opportunity to talk about recovery and addiction issues. And Darren, who do we get to talk recovery with today?
Yeah, we get to talk recovery with, again, with Candace Platter. Welcome back to the show, Candace. We've had you on the show several times. We've talked about a great book, Loving an Addict, Loving Yourself, the top 10 survival tips for loving someone with an addiction, which we all struggle with. There it is. This is it. You're an addictions therapist in private practice, specializing in working with the family and other loved ones of people who are struggling with addiction, with your unique and signature family addiction counseling and therapy program. Let's talk about that. We were just, talking about the awful state of the downtown east side. Conveniently even the worst addiction, the individual with the worst addiction, if there's family right there, if there's mom, dad, brother, sister, uncles, aunts, grandmas, grandpas that can all come in, we're talking a better shot, right? And
definitely.
What about these individuals? I just want to get into this a little bit of an opinion here. In the downtown east side, are these people with like no family, and therefore are they helpless? What's your view on that, Candace? If you don't mind, sharing your thoughts on that.
Yeah, sure. Hi, everyone. I worked in the downtown east side as an addiction counselor for 16 years. And unfortunately, I left about 15 years ago, and it's actually gotten worse instead of getting better. Right. So it saddens me, because I really enjoyed working down there with the clients who were there, with the addicts, the alcoholics. And while I was there, the family members started calling me and saying, we are at the end of our rope, we don't know what to do. And so, at that point, I didn't know how to help them. I had never even thought about that. But I had them come in and listen to what they were doing. And I saw some patterns of what was going on. And there was a lot of enabling going on, where families were giving addicts, alcoholics money, even though they knew where the money was going. There was that kind of enabling happening. I think the answer to your question, Darren, is that addicts, alcoholics, anybody in the position of being in active addiction, whether it's in the downtown east side or not, they need their families so much, but they need their families to be emotionally healthy with them. So there's not a lot of help out there for families of addicts and alcoholics. When I say addict, I mean alcoholic as well. So there's not a lot of help. There's a lot of help out there for the addicts, and you guys do wonderful work around that. There's not a lot of help for the families. They don't know what to do, and they're terrified that they're going to lose the people that they love, and we see it happening all the time. So it makes sense that they're scared about that. But when the families start to understand the difference between enabling an addict and actually helping an addict come out of active addiction, because there are ways to do that, then things start to change in the families. So yeah, they need their families. They need them to be healthy.
And that, I mean, that's in a perfect world, right? I mean,
yeah.
Gabor Mate, he would claim that, most people in the downtown East Side, if not all, have suffered some sort of childhood trauma, or you know what I mean? Like the generation that's been, abused and lived under abusive parenting or alcoholism and drug addiction. What do you like? Is there hope in that, worst case scenario, families all, requiring help and medical help and therapy, and you know what I mean? But maybe they're in a state of refusal themselves. Everyone said, I mean, where do you begin?
Yes, and I'll answer one of your questions first. Is there hope? Yes, there's always hope. If somebody's still with us, there's always hope. And I agree with Gabor Mate totally that underneath it, addiction isn't really about the alcohol. It's not really about the drugs. It's not really about the sex. It's not really about the addiction. It's about the pain that's underneath that. It's about what is making a person do that to themselves. That's what needs to be gotten to. And so, when I see what's happening in the downtown East Side, for example, it's happening all over, but definitely there, where, somebody overdoses and the Narcan is given and the person wakes up, that's the time when you get them into treatment. That's the time, because in rehab, you get underneath the addiction. You talk about what the trauma has been, because until you heal that, the person's going to keep going. I mean, it was that way for me. I'm 35 years clean and sober now. And it was definitely that way for me when I was struggling with opioids. I had a 15-year opioid addiction going on,
What would your life be today if you had an endless amount of safe supply paid for by the government?
Well, I think I'd be using. I would still be using. Mm-hmm. So, I mean, the way I think about this is different than the way other people think about this. I understand the desire for safe supply. I understand harm reduction, and I'll definitely start with somebody there when I'm working with them. I'd like to see people move out of harm reduction and into abstinence and live a better life. If I had a safe supply, because addiction is progressive, and I would need more and more and more of that safe supply. And I don't know if I would get more and more, I don't know how it would be if the government did that. Chances are pretty good I'd still be addicted and that I might even be dead.
Mm-hmm. Yeah, it's one of the things. It's kind of the conundrum we're in with safe supply or safer supply, prescription, taxpayer-funded drugs. It's where does it end, and if addiction is addiction, whether it's gambling or opiates or cocaine, I mean, giving more money to a gambling addict. I mean, you can make all these bizarre scenarios, but I know some gambling addicts that want to blow their head off, because of what they've done and what their experience. I mean, it minimizes almost other addictions, in which we get into when we really talk about prescribing our way out of opiate addictions. So you mentioned enabling and not enabling. So what is enabling, and what are signs of enabling, and what are signs of not doing that?
Yeah. And I think you bring up such a great point. There's so many great points that have already been brought up just today here. We have an enabling society. It's not just families that enable. We're seeing it all over the place. And in my opinion, having been in this profession for 30 years, I'm not seeing it getting any better with all this enabling going on. So, when the question is how has this been working? Like good old Dr. Phil question, right? How's that been working for you? And if the answer is it's not working very well, which I think is the answer right now, then the next question has to be, are you willing to try something different? Because if nothing changes,
Nothing
changes, except that sometimes it gets worse. Sometimes that changes. So I really like simple definitions. And my definition of enabling is when you do something for somebody else that they can and actually should be doing for themselves. And you're doing this on a fairly consistent basis. So
I love that. That's great.
Yeah, it's about rescuing people and not allowing them to get hurt a little bit, to reach a little bit of a bottom or maybe a bigger bottom. It's about people not understanding and feeling their own resilience. Because if you're going to rescue me all the time, I'm not going to feel good about myself, really. I mean, if I'm lazy, and when I was in addiction, I was pretty lazy. If I'm lazy, then yeah, enable me, please. Do everything for me. Do my laundry. Let me live in your house rent free. Let me abuse you. Let me, do all these things. But I don't know of any addict. I don't think I've ever met an addict, including myself, maybe you guys, who has enjoyed the life they're in as a practicing addict in active addiction.
I'm so glad you said that because, I don't know if you read Dr. Sutherland's article that was in the New York Times about 3 months ago. She was highlighted in the New York Times. This reporter just, put the wind in her sail she's the main downtown East Side doctor. She'll look her up, take a look at her payroll too. She's one of the highest paid physicians out there as well.
This is a problem. Somebody's
just
getting rich
look at all
off
the scripts. She's, she might ride a bike to work, but she could be driving a couple of fancy cars if she wanted to.
Yeah.
So she says, you ready for this? I want to hear what you say. So
Okay.
she says in the article that Canadians, no, everybody, not just Canadians, have the right to euphoria, the human right to euphoric experiences when they use drugs. And so there's all of us. We're like, honey, like there's no euphoria going on in those SROs. Like that's not euphoria. Yeah. Like there's a lot of pain after each hoot. You know what I mean?
Yeah.
And to say that and be one of the highest recommended, looked up to speakers on harm reduction and addiction is like, what do you think? Were you euphoric?
There's an interesting euphemism that's used in addiction. People who don't really know what they're talking about, and she may be one of them. I'm not actually that familiar with her, but it's when we talk about partying. They're just going out and partying, Partying is when you start using drugs, maybe at the very beginning, and you're with other people and you're having a good time, and it doesn't take long for many people to not be partying anymore. This is a horrible life to be in. It's horrible.
Finding means and ways.
Nobody wants to be homeless. Nobody wants to be ODing on the street and needing a medic to come and shoot Narcan up their nose. Nobody wants to live like that. And I don't know of any addict who says to themselves, gee, I really like this life. I really like, peeing in the alleys, and I really like, the other people that I'm meeting on the street, and I really like this life, and I think I'll just stay here.
Yeah.
That's not how it works.
No, you
Sorry, I think I'm getting angry.
Well, yeah, and I mean, people people throw it, like, we're not talking about the person that does a little bit of cocaine on a Friday night. We're talking about
No,
people with
that's partying.
substance use disorder. And I think
Yes, we
we're
are.
creating this like case for, people that occasionally use drugs, and moving that philosophy for healthcare for people with serious substance use disorder or substance misuse, whatever you want to call the disease this week. And I think that's what's killing people. So
Yes.
Darren, I just have one more thing I want to throw at Candace, and then you can take over. So, a lot of people don't, and I think we've talked about this on the show too when we had you on as our expert. Um, we talk about wraparound services. So here's a mom. She takes her 17-year-old kid to, St. Paul's Hospital,
Yeah.
and my kid's finally asking for a little bit of help. She doesn't know anything. She doesn't have an uncle in AA. She doesn't know anything,
And
and
she's
so
terrified, and she wants,
she's
yeah,
terrified. She
yep.
goes into this clinic. They tell the mom to sit down. They do this assessment. Kid walks out with a bunch of medications, and they go home. And she's just completely frazzled because they wouldn't let her in the room. The kid's 17, but she wanted to go in. They wouldn't let her in. Nobody talks to her. Nobody does anything to her. And she leaves. Her
I
kid
know.
obviously continues to use. Um, but the kid got medication right away, and this is David EB, our new premier. Like, we need to make sure St. Paul's Hospital can do rapid treatment, and that's the treatment. And so the mom had to go on Google, and luckily she's got a credit card. She paid for an interventionist, and she paid for private treatment, and her kid's now 4 years clean. We've explained that to St. Paul's. Nothing's really changed. Like, you're talking about the family system. I mean, she needed to get well. She was like
Yes.
so
Yes.
entrenched, and her kid is gonna die, and all that kind of stuff. So what would you like to see if you had this? Like, what would you like to see?
I would like to see families worked with. I would like to see there be the kind of services. There's an absolute gap in services. This is one of the reasons that I do the work I do, because I see that gap and I know how necessary it is to work with the families. There's so little help for them out there. It's like they are in the same roller coaster car as the addict that they love so dearly, the person that they remember as not being an addict that they want back, the person they're so afraid is going to die out there. And before they die, they're abusive and obnoxious and manipulative and all the things we all have been in our own addictions. They get into that roller coaster car. What happens to the family is that when the addict is doing okay, when the addict's doing well, they're doing well. Everything's fine. Everything's great. Ah, we're so happy. But inevitably, that roller coaster starts going down. And if somebody's in active addiction, they don't stay up here for very long. They come down, and the family's still in that same car with them, so they're not doing so well. And it's almost like there's an addiction. There's no almost like, it really is. There's an addiction that the family members start to have with the addict. So if the addict is okay, they're okay. If the addict is not okay, they're not okay. They're always shining that spotlight on the addict. What's he doing? How is he or she? How is he? What is he using? Did he use today? What does he say? And that doesn't do anybody any good. It doesn't do the family any good, and it definitely doesn't help the addict. So there needs, yeah, go ahead.
It just makes me so curious, right? Because when you describe that family, that parent, I can envision them being the helicopter parent, as their child was a toddler, and that's just a behavior that's, you know what I mean, that's carried on. And then I think to myself, but I mean, now you have a young adult child, let's say, and there is no backing off of that. There is no letting go. And, oh, my son, he could be in the downtown east side. Who knows where he is today. Carry on with your shopping and your cup of coffee. It must be an impossibility, mentally to adjust to that, and our need as a parent to intervene, to console, to save, right? I mean, it's such a strong,
It's a need,
pathway.
it's an urge, yeah.
Right.
But it needs to be done in a way that's helpful to the addict, not in
Okay,
a
so
way
yeah,
that's
my
enabling to
question
the
would be,
addict.
how do you describe, to a family that's not the approach, and therefore what would the approach be? Because we then talk tough love, right? Which is slam the door in their face, tell them to, they're not welcome, and that seems harsh. So
Right.
is there a middle?
There's absolutely a middle. There are so many things that can be done and tried before that door is slammed. And even when that door is slammed, because sometimes family members are just up to here with what the addict is doing, even if that door is slammed, I suggest to families that they don't deadbolt that door. They don't lock that door, because at any moment, an addict can say to himself or herself, I'm done. I don't want to do this anymore. I don't want to do this. Something can happen, or it's just a gradual getting to that point where an addict says,
Right.
because underneath everything else, staying in active addiction is a choice. We make a choice to stay there, and we make a choice to come out. And so, and I believe that everybody who's in active recovery, like we all are, everybody who is knows that, because we wouldn't be in recovery if we didn't make a choice every day to be in recovery. And for some people, especially in early recovery, you're making that choice every second of every day, but it's a choice that we make. And the addict can make that choice at any point. It's going to be a longer time for them to make that decision if they're enabled.
Right.
If we're
And how,
rescuing an enabled addict, does not recover, because why should they?
yes.
And so we need to be doing the right things so that they have the incentive. Basically, we've been loving our addicts to death, and we need to start loving our addicts to life. And, you talked about tough love. I think my approach is kind of a tough love thing, but I think tough love has gotten a really bad rap, because sometimes love means no.
Right.
Sometimes tough love is the most loving thing that you can do for somebody. I love you so much. I love you so much that I am not willing to watch you be in a life of recovery. I'm not willing to support you in recovery. I am willing to support you. I'm sorry, I said that wrong. I'm not willing to support you in addiction. I'm not willing to watch you be in addiction. It tears my heart out. It's no good for you. I am willing to support you in recovery. That's what I meant to say in the first place. I am definitely willing to support you in recovery. So sometimes when you ask me for $20 and I know it's going to go into your arm, up your nose, down your throat, whatever, I'm going to say no. And it's because I love you so much. It's not a punishment.
Mm-hmm.
And when you're ready for recovery, you let us know, because we love you so much. That is a form of tough love, and I think it's the best love there is.
You just touched on something we kind of talked in the very beginning of the show. Darren and I were just chatting about this idea of compassion, but like self-centered compassion, where really I'm not helping you. I'm helping myself feel good.
That's
by
right.
by doing this, and under the guise of compassion, it's like somebody's
Exactly.
like destroyed, but I'm gonna, I feel good giving you the $20.
I'll scoop them up one more
It's
time.
not, is that compassion? And so there's this thing, like, I just, I know some people that are warriors of the downtown east side, front, like they make it sound like they're soldiers in an army, and it's just like
It's a death
there's
trap.
just so, like, you'll scream from a mountaintop to make sure somebody gets a needle and safe supply, but you won't scream from a mountaintop that somebody gets, a bed-based service, immediately when they
Yes.
want it, like a rich
Yes.
person does. And like,
Yes.
and taking this, two-tiered system apart in Canada for poor people that use drugs and rich people that use drugs, and so that's where I get that from, and that's what you're talking about, is It's
That
just
is what
like,
I'm talking
it's
about.
hard for me not to give you that $20. I'm not going to give it to you. I
Yes,
did the right thing. I feel
I
like
did the right thing.
shit,
And
you
so
know?
I'm going to do the right thing for you, my dear, wonderful, sweet child who's addicted. I'm going to do what's right for you, even when it's hard for me to do that. And the thing that I'm going to do for you, the way that I'm going to love you the most, is I'm going to make it uncomfortable for you to stay in active addiction, for you to keep making that choice. I'm going to make it more uncomfortable for you, not have you have it so cushy, not me rescue you and do your laundry and cook your meals and, you know, that kind of stuff.
My
Which
family didn't
happens in
talk
some.
to me for years when I was out there. I mean, they're just like, you're out, like, see you later. You know, if
Well,
that's what you want to do, if you want to call us for $50 every time, like, we're just done with
yeah,
you. And, you know, those, you know,
there's
that,
a place for that.
you know, and
There's a
they feel
place.
good about it. And I actually respect them now in hindsight. I'm just like, yeah, man, I did some really, really
But
shitty things.
but here's the thing, Giuseppe. If there had been help for them to understand what they could have
Mhm.
done differently with you, they could have tried so many different things to see if anything would stick to the wall, you know,
Mhm.
before they just kicked you out and said, we're done
And
with
that's
you.
why we're never going to get out of this overdose crisis, because I don't see any family plans, recovery coach. I mean, in Alberta, there's
I'm
recovery
here.
coaches.
I'm
Yeah,
here.
but like,
Yeah,
you know what I mean? Like, there's no provincial
that's
solution
right.
for families and
That's right.
collaterals and kids. You know, that have all the, yeah, I mean, it's just we take the kids away, but there's no actual
Yeah,
services to help the family unit. And, you know,
yeah.
it's unfortunate because, like,
Well,
families
you know,
that are calling
I
us, you know, they can go to Al-Anon and Nar-Anon. Mind you, there are some programs, but like, there should be a provincial wide. So I want to, you know, this is probably make, if anyone's listening out there and on the other sphere of responses to overdoses addiction, we're probably making some people feel uncomfortable. For some
yep,
reason,
that's okay.
our lived experience, your lived experience as an opiate user, really doesn't carry the same weight as somebody who's an active using. For some reason, their lived experience is what we need to focus on. Candace, that's your story. You know what I mean? It's not everybody else's. That's kind of how we get brushed off in stakeholder groups. So you use the word addict a lot. That is, I use it all the time. I'm Darren, you know.
I'm an addict. I don't mean any disrespect by using that word. And like you say, this today, you know, maybe they want to call it something different today. Tomorrow it'll be different. To me, it's not a stigma to use that word. I don't think it's a disrespect. So
If I could high five you, I could, you know, like in a little electronic one. Yeah, you know, there's this
yeah.
organization out there, national, they get tons of funding and all that. And like, they just want to destroy that word. And
Well,
we're
but
in rooms. Go ahead.
that's such a waste of time and money.
Yeah.
We could be using that money
Uh,
in such a better way. And this is where I say, you know, our whole society is so enabling. And
yeah.
until, you know, until that changes, there
Yeah.
really isn't a lot of hope
Yeah.
because somebody's getting rich off of this somehow.
We're at this huge event where we're trying to talk about solutions to addiction, and why do you got to use the word clean? And you know, you're saying everyone's
Oh,
dirty, and I'm like, okay, so like, number one, my label has absolutely nothing to do with you. So
right. And you're
sorry,
not
like,
that,
spoiler alert.
and you're not that much of a snowflake,
Yeah,
really.
yeah.
If you're
Spoiler
down there
alert, you know.
putting needles in your arm,
I know you think everything's about you, but it really isn't. It's my
right,
label. And I, you
right,
know, if
yeah,
it makes you feel uncomfortable, well, it makes you feel uncomfortable. It doesn't make me feel uncomfortable.
yeah.
And you know, that's a priority in my life, me. So anyway, I'm having fun with this conversation, but part of the show is also about getting ready for the holidays.
Yeah.
You know, so they're just around the corner. And I don't know about you, Darren, but you got some Christmas gifts you have to buy. So I'm sure there's some stress coming your way as well. And so, you know, how do we get through all this?
You know, there are so many loaded questions for family members who have addicts in their families who they just don't know what to do. And um, it seems like there are like maybe three questions that are important. I'd like to start with one and see what kind of time we have to talk about it. But it's like, do we invite, if we know where our addict is, because some families don't know where their addicts are, And some families have already lost them, which is a pain that, you know, there are no words for that. But if you know where your addict is, it's Christmas. Are you going to invite them? Should we? Should we not? What do we do? How do we do it? Do we have alcohol at our meal? You know, all of those kinds of things start to come into play. And if we're going to invite the addict that we love, who's still in active addiction or very early recovery, maybe, how do we do that? What do we do? So I would like to suggest a way that you can do that. That's helpful and simple, not necessarily easy, but simple. I'm going to simplify it for you. I think the first step is to be able to talk to the rest of your family members. This is, again, as Darren said before, in an ideal world, but maybe some families can do this, where you talk to your family members, you kind of get on the same page. You want to have your beloved brother, sister, son, daughter, whatever, be there with you. So then you go to your addict and you say to them, we love you. We love you so much and we miss you. We don't see you very often. And we'd really like you to come to dinner on Christmas Eve this year. We'd really like you to do that. If you decide to come, this is what's going to be a little different. We're going to expect you to arrive clean and sober and to remain clean and sober for the couple of hours or whatever that you're with us. If you're not able to do that, if you decide you don't want to or you can't handle it, that's okay. We still love you. You don't have to come. But if you would like to come, and we'd love it if you were there, what you need to do is bring your best self, you know, and what this means is that you don't drink anything. You don't sneak off to the bathroom for a couple of lines of Coke. You're not doing that kind of stuff. If you make that decision to come under these conditions and something happens and you make a different decision while you're here, then, you know, if we think that you're drinking or you're starting to not be clean and sober, we're going to take your car keys. We're going to call a cab or an Uber and we're going to pour you into the car and we're going to get you home. And you're not going to be staying with us if that's the choice that you make.
Yeah.
So we'd like you to think about it and let us know, because there's a place at the table for you and we love you so much. So the way that this boundary happens is it's called a sandwich, the sandwich technique, where you start with something positive, then you go into the negative feedback or the constructive feedback that you need to give, and then you end it with something positive.
Interesting.
So you just heard me do that. We love you so much. We'd really like you to be there. This is what's expected. This is what will happen if you don't abide by this, if you make a different decision. And we hope that you can be there and we love you.
And there must be people in that situation being given this instruction that are knowingly saying it, you're not expecting them to abide by these constructs, right?
Well,
I mean, no, I guess it's all complex. I mean, I know for me, as a heroin addict, I could never promise anybody that I'm going to show up sober. And if, you know, it's all these little, you know, slight little adjustments. If I was, you know, going on my 10th hour of not having used and I show up, my propensity to steal, you know, and just to only be thinking about what I can take, even though I don't want to, do you know what I mean? Is running the show. And so therefore, you know, but you're, I believe wholly that, you know, a parent like needs to say those things, that they
Yeah.
would, and they're giving me the option, that they're
You
not
need
just
to,
saying,
that's right.
you are not
That's the
coming
thing.
here, right?
But
You
this
need to
just
give them the choice.
but
Yeah.
it's but this is the thing though, like we're not fixing anything by doing this. It lays the groundwork for the future, right? It's just like, because so many people, when they're brand new to this whole addiction world, I don't have a problem. Okay, well then come to the house, but you can't drink. Well, you drank, so you have to leave. It just lays the foundation for what our relationship is going to be like.
Boundaries.
Because you're not going to be sober for the rest of your life if you sign this contract and you're not going to drink at Christmas dinner. But it just, next time you're like, oh, I don't have a problem. Well, you couldn't even stay sober during Christmas. Oh, well, and then the individual is just like, okay, I'm going to try, or I'm going to lie, or I'm going to, or, you know what I mean? It just lays the groundwork for actually reality and so forth. I mean, according to surveys out there, most people, don't access services, not because of stigma, but because of denial. They don't have a problem. I remember, when I was starting this whole trip like 16 years ago, I didn't think I had a problem until my boss let me sleep on her couch for a couple of days, and I couldn't even couldn't even stay sober during those days. I was like, holy
Yeah.
smokes, what's wrong with me? And I had to leave that
Yeah.
place. So it lays the foundation of reality. It's like, that's the problem with addiction, is so many of us put our heads in the sand. That's what I believe anyway. And it's just like, with this sandwich effect, it's just like proactive. What's our recovery plan? You can be part of it or you cannot be part of it.
And we
It's up
love
to
you either
you.
way.
We love you either way. I love it. I love it. We're running out of time. You're
Oh.
listening to Co-op Radio. What a conversation. We only got one out of the three. We have 3 minutes left.
I can say the other two. If
Okay.
you've lost somebody, my suggestion would be that you don't know where they are, maybe, that you put a chair at your table to honor that person. You love that person, even though they're going through hardship and they're putting you through hardship. You love that person. It's something you can consider doing. The other thing to think about is, if you want your addict to stay clean and sober at your gathering, maybe you don't have alcohol there.
Yeah,
maybe you don't smoke a joint after dinner at the fireplace. Maybe you just don't do that this year. Maybe you support your addict for trying to be there and stay clean and sober. Just saying.
Yeah. Well,
Yeah.
people are dying, and it's like, can you imagine having an uncle, literally 4th stage cancer, lung cancer, literally dying, and you
Yep.
all just start smoking cigarettes
Smoking
and blowing the
cigarettes.
smoke in his
Exactly.
face?
Yeah.
You wouldn't do that. You would,
Yeah.
like, any decent person wouldn't do that anyway. You'd be like, that's rude,
Yep.
But smell my Chianti. You
Well,
know what I mean?
unless you're a cigarette addict and you need a cigarette, you might want to look at that if you do, because there's recovery for you too. Maybe you don't have to die from this. Yeah.
And I really appreciate the, for lack of a better word, the disruption of, it's the holidays, so let's not talk about the discomfort in our family. Let's not mention so and so who's passed on or out there.
No.
Let's pull up a chair. Let's
How
remember.
about if we're real and genuine and authentic and transparent with each other? What if we get healthy?
Yeah, exactly. What if we can have a conversation like it actually exists, rather than you actively denying it when we're together? I mean, that must be such a strong healing approach for families in their therapy, in their discussions, that like they're able to talk openly, and who's to say that can't happen because it's the holidays, or because uncle and aunt are over. They should be brought in too, and
oh my goodness, Darren, you're changing the world. The family talking about real issues at the Christmas and Thanksgiving dinner. No, let's just talk about sports. What's going on in the World Cup. Yeah. So Candace, let's see your book again. How does one find your book? Where's your book? How does one, get services with you? And
okay, thank you. This is my book. It's won some awards, which really, shocked me, because I was an addict, and an addict isn't ever going to do anything helpful for the world, right? But Addicts can change. We can change. So don't give up. So my company is Love with Boundaries, because we have to love, and we have to love with boundaries, with self-respecting boundaries and respectful to the other people too. Lovewithboundaries.com. We work specifically with the families and other loved ones of people who are struggling with addiction. We also work with the addicts when they're ready. Takes them a while usually, but we work with the family first to help them change what they're doing that isn't working. We offer a free 30-minute consultation, an intake call, no obligation at all. If we're fit, if we think you're a fit, then we just get started. And if not, that's absolutely okay. You can call back next year if you want to. So if you want to get in touch with us, if you go to the lovewithboundaries.com website, there's a link for a questionnaire. It's pretty short. You don't have to divulge your whole life, but we need to have a little information about you. So fill out the questionnaire, and as soon as we get it, because we know that addiction does not wait for people, that you need help now because you're reaching out, we'll get back to you right away, sometimes the same day, and we'll set up that call, that free 30-minute call for you. And we're here waiting for you if you need help. And the other thing is, I don't know where your podcast goes, but we work globally. As long as you can speak English and you have Zoom, we can work with you any time zone, any country. It's all over the world. It's so rampant, and we're here to help.
Well, thanks for everything that you do. Thanks for helping families understand it's their recovery journey as well. You're listening to Talk Recovery Radio, powered by New West Recovery, made up of Last Door and Westminster House. And super excited to have you on the show. And we'll be doing more holiday shows as well to get ready for the holidays so you can get through them clean and sober. And shall we add the word serene? Darren, always good to see you. Thanks everybody for listening and watching. If you're on YouTube, click subscribe. If you're listening to one of our streamings, iTunes, SoundCloud, all that stuff, hit like and share. And thanks for listening. We'll catch you next Thursday here on Vancouver Co-op Radio 100.5 FM. Darren, see you later.
Thanks
Happy
so much.
holidays.
Bye-bye, everybody.
Okay, take care.
Bye.
Bye.